So yeah, the main causes for women back pain are things like that. It's more coming from internal rather than external, and yeah, it's definitely more around stress management, keeping everything flowing. Flow is the key word for women, I think, rather than stuckness and tightness. And it's like trying to get out there. And I think a lot of women feel when they get to midlife as well, and maybe they don't realize this, but they're really restricted in, they are the sandwich generation, as in sometimes we've got like younger kids, the teenagers that rely on us. We've also got older family, our parents that start to rely on us. So we're in the middle trying to hold it all together, plus working full time. You know, they said that we could have it all, didn't they? You know, and it's like something's got to give somewhere along the line. That's not the way it is. And usually it is the spine, and keeping the spine healthy. It's like, you and I know, it's like your antennae to the universal energy, right? So it's like there's so much else that shuts down. It's like that energy system that is just getting shut down. And if we can open it and get it healthy again, there's so much more that comes from that than just like being free of pain.
Yeah, I mean, the other thing that's kind of obvious in terms of, you know, the difference between males and females when it comes to back pain, so obviously men don't get pregnant and men don't give birth, right? Which, you know, both those things are very traumatic to that lumbar sacral region, right? So I'm sure you would agree that that's also another major factor in back pain in women, obviously, that have had children.
Yeah, definitely. Pelvic floor, being able to keep the strength. Well, it's not just about strength in the pelvic floor as well. It's about pelvic floor should be able to be toned. I think tone is a better word than strength, because it's not one of those muscles that can be strong. It's tone and relaxation. And I think a lot of people actually try to create that tone because that's what you're told afterwards, after you've had a baby. And that kind of makes sense to us in our heads, in our logical brains, that, okay, it's been really overstretched. We need to now tone it up and get it like tight and strong. But actually a pelvic floor, a fully working and adaptable pelvic floor, should be able to tone when it needs to, and it should also be able to relax when it needs to. And a lot of other women that I work with have got over tone in the pelvic floor rather than, and they can't relax it. It never relaxes. So again, that causes tension through the lumbar spine and into the pelvis, which again, yes, you're right, causes back pain.